Hello. Sorry about the delay here due to some technical problems. We're talking about PRP and platelet-rich plasma today. Most important thing about PRP, which has been quite in the news now. I remember about 5 years ago, people did not have much information about platelets and what their role could be. But basically, this is kind of cell that's found in our blood, along with the red cell, white cell, suspended in plasma. And when we put the sample of your blood through a centrifugation and separation process, we are able to harvest these platelets. And why are platelets so important? They have about 10 plus, more than 10 well-defined growth factors in them, which have anti-inflammatory properties. At the same time, they can help support our existing stem cells in our body to help regeneration and repair. I like to think of PRP more as a fertilizer in the world of regenerative medicine. The stem cells are the seeds, and platelets or PRP is a fertilizer, and it helps our own cells perform or heal better when it is used in the right situation for the right indication. The the process itself is pretty simple. There's a blood draw, and there are a lot of automated systems which are available in the market today, which is a separation, and there's quite a gray area as far as the dose of platelets is concerned. Generally speaking, PRP is defined as anything that's 2 or 3 times the normal platelet count, up to 6, 7, 8 times. And I'm not even sure what the relevance of the amount or the actual number of platelets is, at least based on current knowledge. Maybe one day we'll be able to stratify how many number of platelets actually perform the job that they're intended to perform. But, and then we're not even sure if more platelets is good or bad. But certainly a healthy concentration dose of platelets, as we are seeing in the scientific literature, is what's being used. The good thing about it is obviously it's your own cell, so there are no adverse effects. There might be some injection site pain, just like with any other injection, there is some risk of infection, but not real adverse events in terms of the platelets themselves causing any harm. Widespread use of platelets, especially in sports medicine, dermatology, and gynecology. And I'm sure there is an ever-expanding role for using the platelets. Focused on what my practice is, sports medicine and injuries and orthopedic conditions. When we talk about the commonest joint, the knee pain, there are certain options which are available. Cortisone and hyaluronic acid, also popularly known as Synvisc, and knee arthroscopy. So these are generally the standard of care alternatives that we have for knee pain in majority of the cases. And PRP is starting to make some inroads. We will see why it is not still being accepted as a mainstream treatment option. And there are a couple of factors for that reason. With cortisone, it is a powerful chemical, but studies have shown that it does cause progressive destruction of the cells where the cortisone is injected. It causes local damage of the cells. And that is why it's not uncommon for patients to require multiple treatments of cortisone. And with each treatment, the efficacy or the effectiveness of the injection keeps going down. Also, a lot of time, something patient may not be aware of is that even though cortisone is injected into a joint, it does seep into the rest of the body, and there are some systemic side effects, especially diabetic patients, the blood sugar can jump up, but weight gain and some of the other, with repeated cortisone injections, you're likely to see some of the systemic side effects. It's just like taking, pills, steroid pills or other injections. This was a paper that is just fresh, hot off the press, where they looked at intra-articular corticosteroid injections within the joint and the increased risk of requiring knee arthroplasty. And they found that in a group of patients who had had multiple cortisone injections, the time interval to how soon they needed knee replacement surgery is obviously short, and an increasing number of those patients needed. So even though it might get you some relief in the short term, I think there's general agreement in the medical community that it is not an option that is going to preserve your joint or help you in the long run. With arthroscopic surgery, you have loss of tissue. Surgery by nature itself causes some collateral damage and trauma, and also the treatments designed, especially with meniscectomies and trying to remove portion of the meniscus, torn meniscus, trying to scrape off the cartilage, make the edges fresh, itself leads to removal of some of the tissue that we are actually trying to preserve and regenerate in the joint. The recovery period can be long depending upon how extensive the arthroscopic intervention was. And there is data now showing that patients who have undergone knee arthroscopy also progress much faster towards requiring a knee replacement surgery. So this was a study in 2014 which showed that total knee arthroplasty after previous knee surgery, most of which was arthroscopic knee intervention, the expected interval and the effect on patients' age. So these patients were getting the surgery much sooner than their peers in terms of the intervention if they had had a knee surgery before. It was interesting this morning when I walked into my office. This is the latest issue of British Journal of Sports Medicine. And there's an article that is really looked at all the data from the last 20 years of knee arthroscopy, and they found that it may not be the best option for people under the age of 50 in the younger age group, especially 30 to 50-year-olds. Because it does lead to joint degeneration, osteoarthritis setting in, and then requiring knee replacement surgery. So as you can see in this picture, the younger audience is walking away from the Society of Arthroscopy. Specifically about PRP, there also have been numerous publications, this one particularly looked at tennis elbow, platelet-rich plasma, and versus cortisone injection, and really found PRP to be much superior than steroid injections. This one looked at knee joint PRP versus hyaluronic acid or Synvisc or Hylon, and again found much better pain relief in patients with platelet-rich plasma without the side effects of using foreign agents. This was a study where PRP was studied versus steroid injections for plantar fasciitis. Again, significantly better outcomes in patients with PRP. This is again in another paper looking at plantar fasciitis and tennis elbow, where there was a comparison of PRP versus corticosteroid injections. So there is enough published evidence showing cortisone does not help probably causes more harm. There is published evidence showing that PRP may be superior, not in every case, not in all cases, but given that the downside to getting a PRP injection is not much in terms of side effects, it certainly is the option that I hope is used more and more. This is again in new osteoarthritis in patients, osteoarthritis of the knee, and use of platelet-rich plasma in terms of pain relief and improving joint function. Let me see what the slide shows. This was another study for muscle. There has been a lot of application in the soft tissues also, hamstrings and gluteus muscle. Again, a 2-year follow-up study with the use of PRP. PRP could be used by itself, could also be used in situations I've seen post-surgery when the inflammation does not settle down. So it does have a role. What are its limitations? We're looking at all this data and we think that this should be mainstream medicine and this should be applicable, at least in the world of sports medicine and orthopedic medicine. The limitation is with any biologic therapy right now, especially when we're using your own cells, there is not a standardized protocol. So let's take an example of PRP. How much blood is drawn? Not only that, how the blood is drawn. If there's no free flow of blood, you can activate platelets even as you're drawing blood through a small needle, or applying too much force to draw them. Even that has an impact on the quality of how the PRP is going to perform, because if the platelets get activated prematurely, you might lose all those growth factors. You want the platelets activated as they're going into your joint. So there are different variables, and then also the variability of centrifugation. There are obviously some commercial system, but every commercial system has its own protocol of how much centrifugation, how much of spinning of the blood will take place, and how will you get the PRP prepared. So all of those variables make it very, very difficult to do an apples to apples comparison. Like a foreign agent, a chemical agent, yes, with cortisone, you would know it's a 40 milligram dose of steroids, and then you can do a comparison with how that dose performs. But with PRP, somehow we have not been able to get to a point where there is a standardized protocol so we can say one PRP is similar to the other PRP. One PRP used in one study is the same in another study, because it's not a manufactured product. It has to be created fresh. And then because it's your cells, that's how they're going to perform is going to depend a lot on your body, your health, your general health, what medications you take, you don't take. So we enter into an area where there's a host of variable factors that can affect the quality of the PRP that you're getting. And certainly, because of lack of standardization, we haven't been able to come up with consistent studies showing the benefit, and that is why insurance companies are wary of, paying for the PRP treatment. So it does have a cost involved, and it's unfortunate because when I see patients who've gone 2, 3, 4 cortisone injections just because their insurance covered that, obviously now it's hard for them to spend money on getting a PRP injection. And then just like any other injection or treatment, one injection may not be enough. You might get some relief, but more of PRP might be needed. Everybody's condition is different. So it becomes difficult given the environment in which we practice medicine to really come up with robust studies, robust data, and really being able to advance the science. That is why it's extremely important that all PRP is not the same as we just discussed. And then also, what is the role of PRP? Sometimes when there is actual damage, actual tear, loss of tissue, PRP by itself may not give you the relief. You need to have some form of regenerative cells in there to actually do the job of repair. So if we are trying to go head to head against surgery, then we need to have robust treatment methods that actually will heal a torn ligament or a torn muscle, will actually grow cartilage. And then we enter into this world of stem cells, which is even more gray and even more, lacks more standardization completely. But just giving PRP may not be the answer. And I've seen this happen where patients are treated with PRP only for conditions that clearly would require much more help than just using an PRP agent, and you go through 2-3 months of waiting, and the athlete is not healing or not getting better. So we have to understand, where is PRP a good option? And I think in a lot of inflammatory conditions, plantar fasciitis, tennis elbow, muscle sprains, bursitis, greater trochanter bursitis at the hip, subacromial bursitis, it's an excellent agent because it's going to help your local stem cells to do the job. It's going to take away the inflammation. But when you enter into the area where there is tear, there's actual loss of cartilage, and PRP again becomes a very, very temporary agent and may not get you the results you're looking for. You might need more than that. You might need surgery. And if not surgery, you might need a proper stem cell treatment where enough stem cells, and it's a whole different discussion, is being used. And also you have to match to the goals of the patient. Every patient's goals are different. People who want to get back to playing sports, whether they're playing professional sports or weekend warriors or whatever, they would like to do it at a high level. And so you have to be clear of, is your treatment going to help them achieve that goal? And maybe this, as exciting as PRP or stem cells may sound, maybe that is not the treatment that will get them to that point. I've had interaction with several professional, players, and for them, it's extremely important that they are able to perform at a high level. They're not so concerned about what's going to happen down the road in 5-10 years, because their life, their profession is playing right now and playing at a high level. So your treatment has to be robust enough to get them back into their game as soon as possible with the least amount of downtime and having able to perform that. So, these are good options to have, but again, the treatment has to be designed very, very carefully for every patient. Sorry. So in the end, the most important thing for people looking into PRP treatments is that, first of all, your condition should be properly diagnosed. It has to start with the diagnosis. Too many times we rush into treatment. Stem cell is just a word. It's just another option. It's just an emerging tool. PRP is just another tool. So is cortisone, and so is surgery. So it's not that these are all obviously things designed to help you, but what is being treated for what reason is extremely important. And then the treatment should be decided. And then in the treatment, you can then decide what your options are. What are the mainstream treatment options, and whether PRP would be a good fit for you or not. Because the most important thing in the practice of medicine should be, from where all of this started, which is our oath, which says first do no harm. So as exciting as biologic therapies are, it's good to have knowledge about them, but make sure you have a right diagnosis and your treatment is designed based on what is being treated and what are your ultimate goals, after that treatment. Thank you so much for joining. Again, I apologize for the late start and happy to take any questions right now, or you guys can email